Among those who got the initial shot of the vaccine today is Dr. Chris Goff. He's an intensive care physician and joins us from his hospital in Cardiff, Wales. Dr. Goff, good to see you. Nice of you to take the time today. So first of all, what was that moment like to get that shot?
It was a lovely moment to do something to protect my patients, my colleagues, and my family. I mean, there's nothing more poetic than the first male in the world being called William Shakespeare in Warwickshire being vaccinated, surely. But it's a wonderful thing. It's wonderful, but it comes with caveats. It is not a magic bullet. It is not going to cure things overnight. It is part of a package of measures that will help control this virus. But it is a very welcome measure indeed.
How many hours ago did you get it? What did it feel like? How are you feeling now? Do you feel a little pain in your arm? Just tell me anything.
I had it about 5 hours ago. Mm-hmm. It was a lot like getting the flu jab, but actually I found the flu jab this year slightly more painful. So this one, I didn't even feel it really. You can't see me now, but I've been at work for the last sort of 5 hours since then, looking after sick COVID patients in intensive care. I've been doing my normal job. I've not noticed my arm aching at all. It's just twinging slightly now. It is nothing to worry about. It is absolutely fine. What
is it like to sort of witness this historic moment? Did you ever think that as a physician that you would be in the middle of a global pandemic and, this is one for the ages, right? In terms of a vaccine for something that has impacted billions, well, all of us, impacted the entire world.
Yeah, this is amazing that this vaccine has been produced so quickly. We're really sort of 9 months out of when it started hitting us in Europe and in the UK. And to come up with a vaccine that quickly is phenomenal and really testament to the coordinated effort across the world to try and help tackle this. The vaccine that they're using is actually quite it's an mRNA vaccine, which we don't have any, effective vaccines that work like this before. But the way it works is very clever. And, it's fantastic news that we've got something like this so quickly.
So maybe tell us a little bit about that. How is it clever? Why do you think that this is going to be such an effective part of the toolbox to fight this pandemic?
Well, usually you'd use either sort of inactivated vaccine or a small live vaccine. But the way this works is it allows the cell to create a small amount of what's called the spike protein on the surface of the cell, which is similar to that in the virus. And so the body can recognize it and build up antibodies to it without ever facing the actual virus. So we've not seen that in a vaccine before. It's quite an innovative and clever way of producing a vaccine. And the results are very impressive. Yes, you need to have 2 doses a few weeks apart, but to come up with a vaccine in a new mode that's not been seen before, that should really be suitable for everybody because it's an inactive vaccine. There's no live vaccine. And to do it so quickly I'm amazed.
So when would you become immune, do you think?
Well, the challenge is you won't know if you are immune or whether you're still one of the small minority of people who can get it. Because the trials, although they did it in several, 40,000 or so people, a small number of people who had the COVID vaccine still got COVID. So it's 95% effective. But you don't know if you're in the 19 in 20 group that will be immune or in the 1 in 20 group that are not. So you still need to take the precautions of washing your hands, wearing a face mask, and keeping your space from others where possible. But we do know that people who have the 2 doses at least 21 days apart are much more protected than those people who didn't get the vaccine. What we don't know as well is how long that protection lasts for. So this is all information that I think we will learn as we're going through it, but you're certainly in a better position COVID-wise if you get the vaccine than if you don't.
So are you saying that we could never really be going back to normal, where we would be able to get together in large groups without masking, going to the pub, going to a restaurant? Or, what are your thoughts on all of that? Once many more people, of course, are immune. I'm vaccinated, sorry.
Yeah, I don't know the answer to that question, I'm afraid. I'm not an epidemiologist or a virologist. I specialize in intensive care. I would like to think that, as you know, we've learned so much about this virus over the last 9 months. What more will we learn over the next 6 months as we get more and more people vaccinated? This is the first step, I think, into a more positive and hopeful outlook. And I really believe that 2021 has got to be a whole lot better than 2020.
What was it like in your hospital? I mean, so you got it. Who else got it? We've heard about how this vaccine is very delicate or fragile. It needs to be stored at super cold temperatures, lower than minus 70 degrees Celsius. What has that all been like?
Well, the whole COVID thing over the last 9 or so months has been, for want of a better word, exhausting and draining for everybody. You know, healthcare professionals or not, everybody has made sacrifices over this last year. And we're all a bit fed up of it, aren't we? We want to get our lives back to normal. But from a healthcare perspective, it's been, it's like nothing I've ever seen before. We have hugely changed the way we work. We've expanded, recruited people from other areas to help us in our time of need. And at one stage, we were getting swamped with patients. And I've never seen that before. We're not quite in that situation now here in the UK. We're seeing a sort of a more sustained but slow increase in work for this sort of so-called second wave. But we are seeing different mix of patients. The patients we're getting in intensive care seem to be sicker and have failed treatment on the wards, rather than in the first wave we had generally slightly better people and we had good outcomes. Our outcomes are not quite as good this time. And I think that is why they're sicker, more comorbid. But we are, it's hugely draining. Wearing the personal protective equipment for a long period of time for hours is exhausting. And, it's heart-wrenching seeing people who are unfortunately not going to survive and their relatives having to make the difficult decisions whether they visit them or not. We've had somebody whose sibling or parent had died, and they were then with us in intensive care, and the family were having to make the decision whether to visit or not. Because if they visited, they'd have to self-isolate and wouldn't be able to go to their mother's funeral. That is just so upsetting for everybody involved. And the staff have felt that drain for the last 9 months. And wearing PPE helps nothing. It helps protect us, but it is exhausting, tiring work. And we just really hope that this is the start of things starting to get a bit better, because we all need things to get a bit better soon.
We sure do. Who is next in terms of the groups of people maybe at your hospital who are going to, so you've been vaccinated, and then there will be a new group, right? Every week or so, I guess this will just kind of roll along.
Yeah, so at the moment, as you know, we've all only got limited amounts of the vaccine. There isn't enough for everybody. And so the government are starting with those in the elderly in care homes and the staff that look after them, and those frontline healthcare workers who are particularly at risk or are dealing with the sickest patients. And then we will be working through, I believe, in a systematic approach, tackling both the elderly and slowly getting to younger age groups, and tackling those who have other health comorbidities and are therefore particularly at risk of getting severe COVID.
What do you say to Canadians who are watching as you and your fellow countrymen and women become the first in the world who are maybe skeptical, who are wondering about this? It's coming here to this country in about a week. It hasn't been approved by Health Canada yet, but we expect it probably will be. What do you say to them who have concerns or are worried about this vaccine?
I would say that look at the number of doctors and nurses who are getting it. Generally speaking, we do our research. I've looked through all the publications of the results of the study, the paperwork of the vaccine, and I've been happy to go ahead and have it myself. The results are overwhelming that it significantly shows a benefit. There are very minor side effects, an achy arm, redness and bruising at the site. That's common from any vaccine. I would strongly encourage people to get it.
Dr. Goff, good to speak to you. Thank you very much.
Thank you for your time, Andrew.
That is Dr. Chris Goff joining us from Cardiff, Wales.